I am Dawn Brown and the Clinical Program Director for Power. And I am going to be talking to you today about our new Perinatal Quality Collaborative and the framework that we'll be doing. And so some of the objectives today is I really want you to take away and be able to describe and understand what collaborative work is and what we're going to be doing in Arkansas, and be able to identify those key groups. So understanding, as Dr. Greenfield said, all those acronyms there, and then list ways that you can help to address our current maternal and neonatal health disparities. Oh, let's see. Okay. And so, again, I'm excited to be here to talk to you about the exciting work that we have planned for our state. And I think this slide really reflects the energy around these projects and the intention of the many people who have supported the work that we're really poised to begin. We are beginning an incredible journey to change the trajectory of maternal and neonatal health in Arkansas. And for the first time, Arkansas has a fully functioning PQC, and we are officially an AIM state. And so I we've got a mom and a baby that are enjoying a beautiful day. And that's what we want for all of our moms and babies, that we want that outcome for them. And then I love the door, the door is open and we're ready for everyone to join us and come on in. So this is really big news about the ARPQC and our AIM work. And it couldn't come in a more poignant time because, as Dr. Greenfield, in his presentation, we know that maternal mortality and morbidity continue to rise despite the efforts that we've put towards really trying to address this pressing healthcare crisis. And so let's walk through that door and see what we're going to be doing and how we plan to make a difference in our state. So I'm going to start with a quick update on the current efforts that are going on. This slide, we've got our high-risk pregnancy power. This is a picture of a simulation that we did in our state, which we love what we do there. And since its inception, the power team has really worked to improve maternal and neonatal outcomes across our state. We've done this through education, facilitation. Our neonatal and maternal guidelines are critical. And all these things have helped us be on the front line, really working to make a difference. We introduced maternal safety bundle work in 2017. I pulled out my binder. I still have my original binder at the power workshop that was held in this show barn. And we knew that, we would have to fine tune our focus to be able to support our hospitals as they started this new work, because we know that maternal safety bundles save lives and that they work. So it was really instrumental that the leadership of the high-risk pregnancy program and IDHI really understood that power with our established relationships with our hospitals was really the best approach to start safety bundle work and to move our state forward. So it was really kind of the beginning of collaborative work. And it's been an amazing journey. And we have seen many of our hospitals complete their postpartum hemorrhage and severe hypertension bundles. We did a mini collaborative pilot program in 2021 and 2022, which we highlighted at last spring's power workshop, where we helped 4 hospitals across our state finalize their bundles and then create a framework so that they could show documentation for the work that they were doing. And so that has been, that was a great start to our collaborative work. Let's see. Our state, as we know, has many champions that have worked tirelessly to improve maternal and neonatal outcomes. And in the fall of 2022, we got the news that there were exciting things in the works that were really going to enhance what we were already doing. So let's take a look at that. And like I said, through the years, we know that we've had many maternal and neonatal health leaders that have really worked on setting into play the improvements that would add up to better maternal and neonatal outcomes. Many have contributed their professional expertise and really their heartfelt passion for this work that needs to be done in an effort to make things better. The power team, the high-risk pregnancy program, and all the leaders across our state are all contributing to this cause. As Dr. Greenfield went over our maternal mortality review committee, that legislation was passed, and that we were able to create that along with the maternal perinatal outcomes quality review committee, which is hard to say. So really the pieces of the puzzle were really starting to come together. And as you know, Dr. Greenfield has been a huge advocate for and really instrumental in getting this work done and the ball rolling for our state when it comes to our AIM status and our PQC. And he knew that we really could expand on the work that we're already doing. And then it took other leaders like Dr. Nirvana Manning and Dr. Jennifer Callahan-Carew, which really created that spark for us to be able to pursue grant funding to support these efforts. And in August of 2022, Arkansas became an AIM state. And in September of 2022, we did receive a CDC grant that would fund Arkansas's first perinatal quality collaborative. And we know that the perinatal quality collaborative is going to be instrumental in helping us fulfill our AIM state requirements. And also lead us forward in a larger collaborative work. And so let's take a look. Here's an AIM state, our AIM state slide. And as Dr. Greenfield discussed, it's the Alliance for Innovation on Maternal Health. And we know that they're a quality improvement initiative to support best practice. We know that best practice makes birth safer, it improves maternal health outcomes, and it saves lives. Currently, there's 48 enrolled states and the District of Columbia, and there's 1,841 participating birthing hospitals in the AIM program. And so what did we need to have in place to enroll in AIM? And these are the requirements that our state had to have in place. We needed a maternal mortality review committee, check that, we had that. We needed the ability to collect data. And we needed a state-based multidisciplinary coordinating body. So as we can see in the fall of 2022, all those things came into play. And we talked about what AIM is. They're really a cross-sector commitment designed to support best practice. And we know best practice is what really makes it different. The AIM national team is at the American College of Obstetricians and Gynecologists, and they provide technical assistance and capacity building to interested and enrolled states as we work to improve maternal outcomes with the use of safety bundles and quality improvement. And so I put these are some goals for the AIM program, and I chose these four. They have more than this, but they really align with what we want to do with the ARPQC. And so AIM has a goal to integrate all 50 states, all of our jurisdictions, Indian Health Services, and tribal maternal health entities. And ARPQC wants to enroll all 37 delivering hospitals. That's our goal in our first collaborative. They have a goal of developing patient safety bundles and resources to support quality improvement. We have a plan in place to help roll out safety bundles and have the resources to support you in your quality improvement work. They want to incorporate respectful, equitable, and supportive care to all people in the program. And I feel like that's one of the, that's a very important piece for ARPQC. We want to make sure we're utilizing that equity lens when we develop our programs and our plans, and that all moms receive respectful and supportive care. And then they had a goal of executing a plan to collect and analyze quality improvement data. And we also have a plan to do the same thing. We feel like collecting data is going to be a big game changer for our state. We haven't been organized around that as, one entity. And so we'll be able to look at, what's really going on. All right, so we're going to be utilizing the safe reduction of primary cesarean birth for our first collaborative. And this bundle will provide work utilizing the 4 R's, which we're all, sorry, that's all jumbled up, that we're all very familiar with, except for this bundle will have a 5th R. The 5th R is the newest addition, and it's a respectful, equitable, and supportive care. The AIM team really felt like this was a very needed addition to safety bundle work. So they have kind of transitioned their reduction of peripartum racial and ethnic disparities bundle. That's another one that's always hard to say. It'll be a critical and important element of every bundle going forth. So as they revise bundles, these things will be added. And so we'll be able to make sure that we're really focusing on that within all of the work that we do. All right, and so let's take a look at what we, by being enrolled as an AIM state, what do we get, you know? And so the AIM national team really helps our state develop maternal safety bundle implementation work plans. They also help our team develop a state and hospital level data plans. They've been instrumental in helping us navigate those things. They host monthly calls on data collection and hospital implementation. And they share resources, implementation strategies, and lessons learned with their AIM state. And I think lessons learned are huge because we learn so much from other states. So that's kind of, if we shift that, everyone that joins our collaborative is going to learn from each other as well. So, and then what are the benefits for Arkansas to participate in AIM? It really helps us align our maternal safety efforts on a national, state, and local level. We have access to leading implementation and quality improvement experts, and they provide us a wealth of support in this area. We have access to an intensive technical assistance for things like team-based communication, effective collaboration, and data collection, and then evidence-based implementation resources. That's really going to help us streamline the adoption of our new, our first bundle that we'll work on in our collaborative. And so we have that, you know, why reinvent the wheel when we can, you know, we have that support that's available to us. So let's switch gears and look at perinatal quality collaboratives. This is a map from the National Network of Perinatal Quality Collaboratives, and they're a national organizations where PQCs can join and be a part of their program. And as you can see, we're represented on this map, which we weren't last year. So that's exciting. Same with the AIM. I don't know how many conferences I sit in, they show the map and there's Arkansas in the middle. Gray, not anything going on. So we're excited that we're lime green. So, all right. And so what is a PQC? A Perinatal Quality Collaborative is a state or multi-state network of teams that are working to improve quality care for mothers and babies. And PQCs identify healthcare processes that need to be improved and use the best available methods to make those changes. And why are PQCs important? PQCs are important because they create a platform for collaborative learning, and we know we learn better when we learn together. PQCs are positioned to make changes quickly. So part of our collaborative is making sure we're communicating and everyone knows what's going on, and we identify something, we can rapidly get that out. And I think this is important. PQCs make population-based improvements. As we listen to Dr. Greenfield's presentation, we can utilize information from our MMRC to make sure that we are targeting the things that affect our population, and we work on those projects. And PQCs closely monitor healthcare facility progress, and that's important so that we can share with each other our successes. And let's take a quick look at what PQCs have accomplished. These are some things that we've seen across our country, and they affect both mom and babies, but we know that we've been able to reduce elective deliveries without medical indications before 39 weeks. I remember when that happened in Arkansas, probably 2014, I'm thinking. And that was a collaboration between the Arkansas Hospital Association and the March of Dimes. And they did an amazing job. I was so proud when our hospital could put that banner up that we had things in place to stop those non-medically indicated inductions. The reduction in unnecessary cesarean births among low-risk moms. PQCs have been instrumental in the reduction of healthcare-associated bloodstream infections in newborns. We see that work going on in NICUs in our state and across our country. And we've seen a reduction in severe maternal morbidity from hemorrhage and hypertension. So we know that these bundles, safety bundles work. And then we've seen a reduction in preterm births and improvements in breastfeeding rates. So there's lots of things that PQCs really help us accomplish. And so the next slides we're going to go through are going to kind of talk about the elements that we are working on and feel that are important for our PQC. And so one of the main essential elements for a functioning PQC is that we have a multidisciplinary advisory committee. And so we want to make sure that it's diverse, it reflects Arkansas. We have everyone that needs to be at the table. Clinical leaders, we need clinical leadership, not just at the PQC level, but we need it at the hospital level. So we'll be identifying those leaders. Public health leaders are so important. We have support from our Department of Health, quality improvement advisors. That's where programs like AIM and the CDC, the National Network for Perinatal Quality Collaboratives, are going to be able to be those quality improvement advisors for our PQC. And family representatives. It's so important that we have the patient voice. In the last 2 weeks, I've been on 2 different webinars where they've used the term lived and living experience. And what we found, we had an interview with a mom that delivered in Arkansas with an adverse outcome many, many years ago. She's still living that experience. It still comes up for her probably daily. So we want to make sure that that's represented in our PQC. Organizational structure, communication systems, and data management plans are also important. And PQCs follow 3 steps to successfully do quality improvement. And the first thing they do is they recruit multiple hospitals to participate. We know that when we come together to work, we empower our hospitals to have that multidisciplinary approach in their own facilities, and we apply various tools to improve healthcare practices. Secondly, PQCs rapidly collect, analyze, and share project results. Being able to share that within our collaborative, I think, is going to be huge, because when we see that we're making improvements, we get excited. We get excited for ourselves. We get excited for each other. And third, PQCs facilitate collaborative learning. We know that when your hospital participates in our PQC, you're going to become part of our collaborative environment, and you're going to have educational offerings, learning sessions, monthly calls, the ability to review your data. We'll be able to share best practices between ourselves and discuss opportunities for improvement. All right, so here's engagement and buy-in, huge, huge, huge. We see the leadership word again. I'm not going to spend a lot of time, but it takes all of us from our own leadership perspective and leaders from across our state and our organizations. As a collaborative, we want to make sure that our roles and responsibilities are clarified. So when we launch this in July, we want to make sure everybody understands what everyone's responsibilities and roles are. We use collaboration to develop and build teamwork with our hospitals. And then our recruitment package. We were so excited to send out our first email last week with our recruitment package to our nurse managers in our hospitals. And we'll be working on this for the rest of April, May, and June to make sure we have hit every hospital, answered every question. This will happen with information calls, in-person visits, because we really want to promote buy-in and engagement. This is a quick snapshot of our flyer. Breakout session A, Dr. Callahan, Carew, and myself will be talking about our recruitment package, PQCs. Please come with your questions. But we wanted to create a flyer that really was kind of like frequently asked, what is a PQC? How can we, what have PQCs done? It's a great snapshot of Arkansas's cesarean record, basically. And as you can see, we're well above the national average. The national average is above the healthy people goal. So there's a lot of work that needs to be done there. And then how can Arkansas PQC help you in this journey? And so when we think about our launch of our initiative, there's a lot of things that go into that as well. Topic selection, that was done on the front end with our grant. But we knew that this was a topic that would have a big impact and was important to the patients of Arkansas. We need to make sure that our focus, vision, mission, and goals for the ARPQC are clear. We've looked at what is our learning methodology going to look like, leadership again. We keep seeing leadership, making sure we recruit that. And then evaluation plans, dissemination. How do we sustain this? What's our sustainability plan? Those are the things that we've really looked at early on. And then using the ARPQC website, which is coming soon, but also our branding. This slide deck is part of our branding, so we were glad to use that to make sure that we can share and recognize our hospitals. This is a quick snapshot of our participation agreement. I'm going to spend a lot of time, but it just kind of goes through our background, why we need to work on decreasing unnecessary cesarean births, and then what is the expectations for our hospitals and what can you expect from us? More detail on that. Oh, going the wrong way, sorry. All right, data collection and management. This is really critical. We want to make sure that we have outcomes, process, and balancing measures in place. We want to make sure that our teams understand how they will access and report their data. We want to make that a process that's not a burden. We want to make sure that the data we request and provide you is relevant to the work that you'll be doing. Implementing our data sharing agreements, which that was part of our recruitment package, and we'll go over that and breakout A as well. Making sure we have those in place so that we can collect data, and then determine a plan for what that looks like and reporting what does our analysis look like and how do we provide feedback to our hospitals. Quality improvement methods. Quality improvement is going to be front and center with our collaborative. So we really have, spent the time really identifying a standard quality improvement model that we want to use within our collaborative and within our hospitals. And we want this quality improvement model. It may be something you're already doing, but if not, maybe it's something you can add to the quality improvement work that you're already doing in your hospital. So we want to provide you with quality improvement education, implementation support throughout the initiative. And this will come in the form of coaching and introduction and using different quality improvement tools. And we want to provide you those tools and resources for your team so that we can support you as you do this quality, as you do your safety bundle work. So this is the model for improvement. This is what we'll be using for our collaborative. And I'm sure most of you have seen this before. It's been used throughout healthcare for a long time. And this model has 3 fundamental questions that can be addressed in any order. But those are, what are we trying to accomplish? How will we know that a change is an improvement? That's always the big question. And then what changes can we make that will result in improvement? And then the second piece of this model is the PDSA cycle, which we all know is, one of the best tools we can use, especially when we're trying to change things in a real work setting. So more details to come on this quality improvement model. So, and then let's look at dissemination and communication. As I said, we want to make sure that the dissemination plan is purposeful, that it raises awareness, that it informs, it engages, and it promotes your work and the results that we'll see. And our communication plan is really just to be early and frequent from the beginning of action to the results. We want to make sure that everybody's in the loop and we're communicating in a way that's very productive. And then finally, sustainability. Everyone needs a sustainability plan. It's really your roadmap to achieving your long-term goals. And so we want to make sure that for our PQC, we want to see this going forward long into the future. And so we look at what supports we have, what resources we have to make sure that we can be sustainable. So. All right, and that wraps up my short, brief, spectacular talk about PQCs and AIM and the work that we're going to be doing. And I just really want to thank you for the work that all of you are already doing. I want to thank you for your curiosity and for being engaged in the work that we're proposing for our state. And I want to thank you for being the voice and champion for respectful and equitable care for all patients in Arkansas. All right, thank you.